Hi everyone, this is Peter. A few days ago, Wen Chen, Deputy Director of the Chinese Academy of Engineering and an expert in respiratory and critical care medicine, made this point in an interview. He said that pneumonia caused by the new coronavirus could turn into a chronic, human-like illness that persists for a long time like the flu. This possibility is entirely present, and we must be prepared for it. It is possible that the disease may turn into a chronic, human-like illness like the flu, and this possibility is entirely present. The COVID-19 virus will most likely accompany humans for a long time. How will it respond in the future? We must be prepared for this, based on the epidemiology, virological biology, clinical prevention and treatment measures, and preventive measures in production and life, according to the characteristics of the disease arrange accordingly. Now that there is a possibility of long-term coexistence, the work has been reworked one after another. How does daily life continue? How to deal with anxiety? How can companies ease the possible tension and anxiety of employees? National Health and Construction Commission responds. Response should be made early. 1. In combination with workplace health promotion and the construction of healthy enterprises, use various methods to carry out propaganda and education on COVID-19 pneumonia prevention and control knowledge. Guide employees to scientifically and rationally understand the epidemic situation. Do a good job of personal protection, and understand and support the prevention and control work. The COVID-19 virus will most likely accompany humans for a long time. How will it respond in the future? 2. Understand and grasp the mental health status of employees in time, and relieve the tension and anxiety of employees. To provide mental health services, psychological consultation telephones can be set up. Those with medical offices can play the role of medical offices. Those without medical offices can rely on professional institutions such as mental health or disease control. 3. When it is found that the emergence of a group psychological crisis may occur, it can promptly report to the working group of the Joint Epidemic Prevention and Joint Control Working Mechanism and take effective measures. It is recommended to take effective measures to prevent and stop discrimination against sick and suspected sick employees. Second, how should I go to work to do both personal protection and normal work? The National Health and Construction Commission responded to the recommendations as follows. 1. Pay attention to personal protection. Workplaces are recommended to wear masks throughout. If there is dust or poisonous hazards in the workplace, both prevention and control of the COVID-19 virus and the exposure to hazard factors must be considered, and parameters such as filtration efficiency and tightness of particulate matter must meet the requirements. Offices can be worn without masks in single-person work. Masks should be worn in multi-person work. The COVID-19 virus will most likely accompany humans for a long time. How will it respond in the future? If possible, the distance between the seats can be appropriately increased. Fabrics such as work clothes and seat covers should be kept clean and regularly disinfected. 2. Strengthen hand hygiene measures. You must develop the habit of washing your hands frequently and properly. When not sure if your hands are clean, avoid touching your mouth, nose, and eyes with your hands. Minimize hand contact with public objects and parts. The workbench, operation buttons, and surface of office items are regularly disinfected. Equipment operated by multiple persons is required to disinfect the surfaces of objects or accessories that are in contact with more than one person, and allows gloves to be worn for operation. 3. Reduce crowd gathering. Avoid crowds, especially places with poor air mobility, and go out to do personal protection and hand hygiene. If there is a canteen in the enterprise, it can be implemented to dine at peaks or packed into their own departments, workshops, or provide box lunches, bring their own lunch boxes, etc., and keep a certain distance from others when dining. The COVID-19 virus will most likely accompany humans for a long time. How will it respond in the future? 4. Pay attention to your physical condition. Once fever, fatigue, cough and other symptoms occur, avoid contact with others and wear masks. Go to the designated hospital in time according to regulations. Try to avoid taking public transportation such as buses, subways and other public transport. You should wear medical surgical masks or all the way to the hospital higher level masks. 3. How should the clothes be disinfected after going home? The National Health Commission responded. 1. Daily clothes should be hung directly at the door after returning home. Separate the outer clothes from the home clothes. It is not necessary to go back every day to disinfect the clothes. 2. If you feel that the jacket may be contaminated, for example, go to the hospital, visit the patient, and contact some people with suspicious symptoms. In this case, you need to disinfect the jacket. Use physical disinfection as much as possible, and use chemical disinfection if physical disinfection fails. For example, as long as the clothes are resistant to high temperatures, you can choose 56 degrees Celsius for 30 minutes. If you have a dryer, you can also adjust the temperature to more than 80 degrees. Drying for 20 minutes can also disinfect. The COVID-19 virus will most likely accompany humans for a long time. How will it respond in the future? If the clothing fabric is not resistant to high temperatures, chemical disinfectants can also be used for soaking and disinfecting. When soaking with chemical disinfectants, these types of disinfectants are commonly used. One is phenol disinfectant. The second is quaternary ammonium salt disinfectant. The third is chlorine-containing disinfectant, represented by 84 disinfectant. These three types of disinfectants can be used to disinfect clothes, and must be operated according to the dosage of the instructions. These three disinfectants have their own disadvantages, so pay attention when using them. Phenolic disinfectants sometimes color chemical fiber materials and may cause them to discolor. Chlorine-containing disinfectants, such as 84 disinfectant, may discolor clothing and bleach. Quaternary ammonium salt disinfectants, if used together with anionic surfactants, such as washing powder and soap, will fail on both sides, which can neither disinfect nor clean. Therefore, the disinfectant should be selected according to the actual situation. Alright, chat here today. If you have any questions, please leave a message for me. Please also like my friends to subscribe to my channel.